Hello, good morning, good afternoon, or good evening to everyone joining us from different regions. My name is Helmut Schwarzer, Head of the Public Finance, Actuarial and Statistical Services Unit at the Universal Social Protection Department of the ILO. I will be your moderator today. It is a great pleasure to welcome you to today's webinar with the title From Actuarial Analysis to Policy Decisions, Country Experiences and Digital Tools for Sustainable Social Protection. This webinar is co-organized with the International Social Security Association, ISSA, and we are very pleased to collaborate on this important topic. Before we move, please note that we have simultaneous interpretation in English, French, and Russian. You can select your preferred language using the interpretation button at the bottom of your screen. This session is being recorded and it will be shared on socialprotection.org. You can post your questions via the Q&A box or raise your hand during the discussion. You may also use the chat to introduce yourself or share comments. As a framing for our webinar, across countries, institutions managing social protection systems are under increasing challenges to ensure financial sustainability, to expand coverage, and to respond to demographic and labor market changes. In this context, actuarial work is not only a technical exercise, it is a core governance tool supporting better data, more transparency, and more informed decision-making. At the same time, many institutions face practical challenges: limited data, limited tools, limited internal capacity. Today's discussion is therefore about real challenges and how institutions address them in practice. This session is part of the ILO Flagship Programme on building social protection floors for all. Before we move into this technical discussion, it is my great pleasure to give the floor to Ms. Valerie Schmitt, Deputy Director of the ILO Universal Social Protection Department and Manager of ILO's Global Flagship Programme on Social Protection Floors. Valerie will share reflections on how the flagship program links the extension of social protection with the need to ensure its financial sustainability and how it has supported countries in strengthening actuarial capacity. Valerie, the floor is yours.
Thank you. Thank you, Helmut, and a warm welcome to all of you, wherever you are in this part of the globe, in Asia. I know we have some colleagues from India, so a warm welcome from my side. Today's webinar, as Helmut mentioned, is part of a webinar series entitled Building Social Protection Floors for All, Key Achievements and Future Priorities of the ILO's Flagship Programme. I would like to take the opportunity to thank the governments of Belgium and Luxembourg who have really supported us in making these webinars possible. This webinar series aims to showcase the key achievements of the second phase of our flagship program from 2021 to 2025, to highlight also priority thematic areas and strategic approaches under the phase 3 of the flagship program, which is starting now and will end in 2030. To facilitate knowledge sharing and peer learning, and also to provide a platform to engage development partners, governments, social partners, national social security institutions, experts, and this will increase, of course, the visibility of ongoing and future projects of the ILO and also of its partners. So following the previous 4 sessions of this webinar series on unemployment protection in January, on statistics in February, on health protection in March, on financing social protection in April, This is the 5th session of our webinar series. In case you missed one of the previous webinars, you will find the recordings on socialprotection.org and as well as on our ILO social protection platform. The last session of the webinar series will take place on 26 May, so in a few weeks, and it will focus on social protection and investments, and we really hope to also welcome you to this last webinar. Since its start in 2016, ILO's flagship program has supported over 50 countries in designing, developing, strengthening their national social protection systems. The flagship program also supports countries in the development of knowledge and in the provision also of very specialized technical expertise, such as actuarial analysis, which is the topic of today's webinar. In the framework of the flagship program, the ILO has supported actuarial work in more than 20 countries across all regions, covering pensions, pension reforms, health insurance, unemployment insurance, and other branches. And I'm very happy that we have today with us Mr. Henryman Mono from Zambia. Zambia, as many of you may know, is one of the priority countries of the flagship program, and very honored to have also Mr. Ashok Kumar Singh, who is the Director General of ISSA India, that the ILO is also supporting through a number of actuarial tools, especially the online tools of the ILO. Our actuarial work has gone beyond analysis. It has supported reforms, new schemes design, and policy decisions in line with international social security standards. And it also contributed to strengthening the financial governance of national social protection systems. At the same time, our teams have really tried to focus on building national actuarial capacity through training, through the development of models and methodologies, and I'm sure my colleague Andres will explain a little bit more about that, and through supporting institutions to carry out their own actuarial analysis. So this experience shows that actuarial analysis is essential to understand, of course, long-term financial implications, to inform policy choices, and also to ensure systems remain sustainable as they expand. And also what is great about today's webinar is that we will be able to illustrate some of these issues through two concrete country experiences in Zambia and in India. So thanks a lot for joining us, and back to you, Helmut. Thank you.
Thank you so much, Valerie, for this overview, this introduction, setting the scene. We are also very pleased to have a video message from our partner, ISSA, from the Secretary General, Marcelo Abiramia Caetano, and he will send us a greeting. Let us please play the video.
So hello, everybody. So as usual, a very good morning for Americas, and today also for Africa and Europe. A good morning for these three continents, and a good afternoon or even good evening for Asia and the Pacific. So my name is Marcelo Caetano, and I am the Secretary General of ISSA, International Social Security Association. So we are continuing the series of webinars today. Today, more concretely, we have two different webinars. And the webinar this morning is on actuary, and more concretely from actuarial analysis to policy decisions, country experience, and digital tools for sustainable social protection. So before saying who is the moderator and also the speakers of this webinar today, let me thank the ILO for the very intense and fruitful collaboration that ILO has with us in ISSA. In fact, ISSA is part of the ILO, but we have many sorts of collaborations, and this collaboration on actuary and actuarial tools is just one of the wide range of examples of collaborations that we have with the ILO. So thank you very much, the ILO, for this collaboration. More concretely today, thank specifically to this collaboration with the actuarial platform and actuarial analysis. So this webinar will be moderated by Helmut Schwazer from the ILO, the International Labor Organization. Helmut, who is head of public finance, actuarial, and statistics service of the ILO. As speakers, we have speakers from the ILO, from ISSA, and from country experience. So from the ILO, the International Labor Organizations, with us today, we have Andrés Acuna-Ulate. Andrés, who is Social Security Actuary of the Universal Social Protection Department at the ILO. Also with us, from ISSA, the National Social Security Association, working with us, we have Fayad André Khan. Fayad, who is technical specialist in Social Security, and he is also the coordinator of the Technical Commission on Statistical, Actuarial, and Financial Studies. From country perspectives, we have from Africa, Herman Munu. Herman, who is Director of Research and Planning of the National Health Insurance Management Authority in Zambia. So thank you very much, Herman, to be with us. And also with us from Asia, we have Jay Prakash Sharma. Jay, who is Joint Director of ICT and Actuarial of the Employment State Insurance Corporation from India. So thank you all for being speakers at this webinar. Speakers from ILO, from ISSA, from Zambia, from India. So this shows the level of interaction that we have. So before giving the floor to Helmut, let me remind our African membership on the major event of Social Security from ISSA in Africa, that is the Regional Social Security Forum for Africa, which will be in Kampala, Uganda, from the 1st to the 3rd of September this year. Registrations are open, so if you belong to the community of members in Africa of ISSA, you are able to register yourself already there. And I'm sure that it will be a quite interesting event because we broke all records of submissions for the Good Practice Award, regardless if we are talking about the number of submissions, the number of countries that submitted, or the number of institutions that submitted to the Good Practice Award. So it will be a quite interesting experience from our African membership to see you at the Regional Social Security Forum of Africa from the 1st to the 3rd of September this year in Kampala, Uganda. Registrations are open. And the second big event that we will have this year as well, and that is super related to the topic of this webinar today, is the Actuarial and Investment Conference that will be in Rabat, Morocco from the 1st to the 3rd of December this year. For the moment, save the date, but I'm sure that this event will be quite interesting for those who are attending this webinar today because the topic is totally related one to another. So I wish all of you a very good, a wonderful webinar. Unfortunately, I'm not able to attend this webinar today, so I record these opening remarks to you. So thank you all very much. And now I give the floor to Helmut. Helmut, please, the floor is yours.
Yeah, thank you very much, Marcelo, for this greeting and also for the strong collaboration between ISSA and ILO. Just a complementation of the information that Marcelo provided. He taped this video last week. He had to travel afterwards, and we are very happy that Mr. Ashok Kumar Singh, the Director General of ESIC India, could confirm his participation. So it was not possible to update what Marcelo said in the video, but we are very happy to have Mr. Ashok together with Jay Prakash in this panel to present on the country experience. The panel was largely introduced, presented partly by Valerie, partly by Marcelo. And we can now move to the technical part. And I would give the floor then to my colleague Andres Acuna-Ulate from the ILO to speak for 8 minutes about his experience in supporting countries as an actuary. Which are, in your view, some practical challenges that the institutions face in their actuarial work, and how these challenges link with policy decisions? Your floor is yours, Andres. You're muted.
Thank you very much, Helmut. I will share my screen in a second. So we have a strange case where it doesn't allow me to share my screen. So yes, so maybe the colleagues from can help me with this. Okay.
Yeah. Fernanda has shared.
So thank you very much, Fernanda. So now I will talk about the main practical challenge for actuarial work. So those are based on my experience, and I think that they could be part of everybody's experience in many cases. So next. So basically, the main question is, what do we need for actuarial work? So in this case, we need a market for actuarial work on social protection institutions. Meaning actuarial work is, maybe some people could do it out of their own heart, but if we don't have the supply and the demand, especially of the actuarial work, we don't have any of its advantages. And by the supply, I mean the production of the actuarial work, and for the supply, I mean the production of actuarial results, and the demand is the use of these actuarial results for decisions. And this is key. Like we need institutions able to use actuarial results in their decisions, and institutions that have the capacity to obtain these actuarial results from to base these decisions. Now, next. So, as you mentioned, production and use. So, what do we need for the production of actuarial work? Basically, we need data, knowledge, technology, and time. So, as usual, there is adjustments. So, if we don't have enough of technology, we need more time. If we don't have enough data, we need more time. If we don't have knowledge, we need more time or more technology. That all of them work together. So we need to find ways to obtain this technology, to obtain this knowledge, and to obtain the data, and find the time to prepare it. Now, what do we need to use actuarial data for decisions? Next. So we need knowledge, data, technology, and time. We require different kind of knowledge, a different set of data, some special technologies, and also the time to understand the information, to obtain to use the actuarial report. So some efforts have to be in the technical side, from efforts have to be in the policy side. Some people have to choose to learn about how to interpret the actuarial reports. Because if the administration doesn't know how to interpret actuarial results, the actuarial results could be misused, misinterpreted, or could be really dangerous sometimes. Could be when the message is completely misunderstood, the institution could suffer. So we need from both sides these efforts. Next. Now, one important thing is that all of this, the knowledge and experience, and this needs to be created, work on the individuals, but also in terms of the institution, and especially for data and technology, we need to have works that make that link the financial reporting with the day-to-day transactions that happen in the institution. Any extra step in the reporting of something means more complications. And to make matters even more complicated, because we have that the knowledge is it has to be institutionalized, but it belongs to people also. So we need to keep all of this together. Next, all of these, next slide, please. All of these have to be developed in an atmosphere that is both at the same time stable, but ever innovating, meaning we need to find some ways that some things stay the same so we could link them and we could know them, but at the same time that we are changing with the times in all of these issues, meaning we for example, I will put an example of an actuarial evaluation. If somebody knows how to do an actuarial evaluation with the technology of the 2000s, this knowledge has to stay in the institution, but they have to be updated so the technology and the information of 2020 could be useful for a new and better actuarial evaluation. If the data from the 2000s still exists, we need to improve it to show the technology of now, but never losing it. So it's a very difficult dance, and it's a very complex set of requests. So I have a set of key messages that I would like to say. That is, the actuarial learning is a process, is never finished. The actuaries die learning. So you don't have ever somebody whose training on actuarial matters is over. We need to find ways to protect all of your advances, especially in terms of knowledge and technology and information. We need to see the way to maintain it, to keep it, to record it, and to sustain it. In the case of knowledge, is very complex because many institutions, when they train a great actuary or a great quantitative expert, the market also wants to take him or her. So sometimes it's very difficult to the game of training somebody to become so knowledgeable and at the same time protect that person from finding other opportunities. Because if we keep changing everything, every valuation feels like the first, and a first valuation is very complex. So we don't want to live always in the first valuation. Opportunities to share experiences between institutions are key. So your institution is unique, but other people have gone through the same problems, and maybe their solutions could be useful. The best investment you can do is institutionalizing processes and knowledge. So next, I hope I am under the time that I was granted, and I have only time to thank you all for your attention. I hope to hear your very interesting questions. Thank you a lot. Thanks a lot.
Thank you so much, Andres, for your presentation. I think that you brought in several of the important dimensions of this discussion. On the one hand, actuarial work needs data, needs knowledge, needs technology. As you said, the techniques, the actuarial technique. So these are inputs. At the same time, you also need time. Sometimes the timing of actuarial work, which requires an effort to reach results, needs to be adjusted, or needs to be compatible with political timing as well to support the decisions. Then the issue of interpretation you mentioned, so the kind of translation from the technical to the political dimension of the results of actuarial work. And so I take from your presentation that this is an institutional learning process where you need to make the balance between stability on the one hand, innovation on the other hand, using the best knowledge available, the best techniques available to improve more and more over time. Thank you so much for this introduction, Andres, and I will give now the floor to my colleague Feyyad from ISSA. And with a question on building on these challenges, perhaps the role of ISSA guidelines and international collaboration in helping institutions strengthen the governance and quality of actuarial work. Please, the floor is yours, Feyyad. You have 8 minutes.
Thank you, Helmut. Just to confirm, is this sharing okay?
Yes, we see two slides. Your next slide as well.
Oh,
so
no,
you just need to change the display settings.
Okay, great.
Yes, now it's
okay, perfect. Thank you, Helmut, and good morning and good afternoon to everyone, depending on where you are in the world. And thanks for the introductions. I am. This thing just came off. Right. Yeah, so I am Feyyad Khan. I'm an actuary working with the ISSA, and just like to say that the ISSA, together with the ILO, has developed guidelines on actuarial work for Social Security. It provides detailed guidance not only on the technical analysis that we discussed with Andres, but we also focus on how that work is organized and used within institutions. So what I'd like to focus on today is really that second dimension. So I'd like to focus on how actuarial work becomes a practical tool for governance and decision making. Right. So this slide really illustrates that something I'd like to say across regions, social security institutions are investing more and more in actuarial work, whether it be internal, whether it be external. There's a big focus on technical work. And most systems today are producing valuations, projections, and increasingly sophisticated analyses with all the advancements in technology. So what I'd like to say is that despite all these changes, from the ISSA's experience, we see a recurring challenge everywhere. These outputs do not always translate into decisions. So reports get produced, but they're not always used. They may be technically strong, but not always understood outside of actuarial teams. So the issue is not necessarily the model or the mathematics. The real issue is whether actuarial work is institutionalized, trusted, and somehow connected strategically or connected to decision making. And that is one of the gaps that the ILO and ISSA guidelines on actuarial work really addresses. So the ISSA guidelines approach actuarial work quite differently from a purely technical standard. It's framed as a core governance function. It's alongside audit, risk management, and internal controls. So just three elements I'd like to highlight here that are really a key theme of the guidelines. First is that of institutional ownership. So actuarial work should not be something that's outsourced or done internally and then forgotten. Institutions need to define why the analysis is being done, how often it's being done, and also how the results would be used. Secondly, independence and credibility of results. Actuaries need to be able to provide some sort of objective analysis in accordance with some standards. And these are supported by transparent methodologies and where appropriate, some sort of independent review even. And thirdly, and perhaps this is one of the key areas, is with respect to decision-oriented communication. So actuarial results must be presented in a way such that governing boards, ministries, and other social partners can easily understand and use, because ultimately this work is not done just to produce a report. It's really done to support decision making. So what does it mean in practice? Well, the guidelines are very concrete on this, and I'll just like to highlight some more areas here. Firstly, regular and mandatory actuarial evaluations. The guidelines emphasize that actuarial analysis should not happen only in moments of crisis or when a reform is happening. It should be conducted on a periodic basis, usually every 3 to 5 years for pension type systems, and more frequently for other schemes. And importantly, it should always accompany any sort of major policy changes. So this allows institutions to move from reactive decision-making to forward-looking planning. Second issue is with respect to transparency and assumption setting. So the institution itself, not just the actuary, but the institution itself has responsibility for the data and the assumptions and documentation. These assumptions must be clearly justified and tested, and where applicable, sensitivity analysis done. This transparency is critical, not just for technical quality, but for building trust with decision makers and stakeholders. And third, and most importantly, is the use for strategy and reform. So actuarial reports are not meant to sit on shelves. They're meant to inform decisions on contribution rates, benefit levels, funding approaches, and long-term sustainability. From an ISSA perspective, actuarial work is successful when it contributes to policy dialogue and strategic decision-making, not only when it meets some sort of compliance or requirement or a checkbox. Within the ISSA, this governance approach to actuarial work is fully reflected in our priorities for the current triennium. So what the slide shows is that actuarial capacity is not just confined to one area. It supports multiple strategic objectives. Firstly, financial sustainability and financing governance. So that's the obvious one. That's where everyone focuses when they hear about actuarial work and the analysis. It provides the foundation for contribution policies, benefit commitments, solvency assessments, and so on, right? Also on the investment side, it plays an important role in supporting investments and reserve management decisions. So that's the first thing that everyone thinks of when they hear about actuarial work. Secondly, though, there's also an emphasis on institutional capacity and risk management. So increasingly, institutions are moving from static projections to scenario-based analyses, and this allows them to assess risks related to demographics, labor markets, and economic volatility, right? And it helps us all to plan accordingly. Thirdly, coverage adequacy and demographic change. Actuarial work is essential when we go about expanding coverage, when we adapt to aging populations, and when we always try to balance adequacy with affordability in the long term. Right? So beyond these three areas, actuarial analysis also supports all other priority agents for social insurance institutions. We support digital transformation, for example, data governance, broader policy design. So it really is, in our perspective, a sort of strategic enabler across the entire institution. Right? So how does this support its members? Of course, guidelines is just one part of the equation. So ISSA's role goes beyond these standards and focuses on implementation and peer learning, right? So we support our members through a wide range of activities, including webinars, technical seminars, and structured training programs, including diploma training on actuarial work. These activities are designed not only to strengthen technical skills, but also to build the governance within the institutions. One key milestone, I think the Secretary General mentioned it in his opening remarks, is the 22nd International Conference of Social Security Actuaries, Statisticians, and Investment Specialists. And that's taking place this year in Rabat in December 2026. The theme of this conference is From Stability to Resilience, and it reflects the need to link actuarial analysis more closely with financing, risk management, and decision-making, policy decision-making, right? So these types of platforms are really important to translate the standards into some sort of real, tangible practice. From our experience, and I think Andre spoke to this, peer learning, we also share the view that it's critical. So from ISSA's experience, institutions very uncommonly, they move forward in isolation. Peer learning plays a critical role in building confidence and momentum. When institutions see how others are using actuarial analysis to go about their own reforms, it gives them confidence. It reduces their hesitation to do it themselves. It helps create this shared understanding that actuarial-based decision-making is not something that's exceptional or unique to your country. It's a general part of good governance everywhere. And over time, this, of course, helps shift the culture from a reactive one to a more proactive one. And it's really just for the benefit of the long-term health of all these institutions. So I'd just like to end by saying three key messages. First, actuarial analysis is fundamentally a governance responsibility. It's not just a technical exercise. Secondly, the ISSA guidelines help institutions translate actuarial inputs into clear, credible, and actionable decisions. And finally, sustainable actuarial capacity is built through continuity, peer learning, and international collaboration and practice. So the country experiences we will hear from next will further illustrate these issues. You know, they'll discuss how they went about from analysis to decision making. And I hope I'm within my time. Thank you very much for your attention, and I'm happy to take questions.
Thank you so much, Fayad, for this presentation. And in thanking you, I also would like to thank to all the ISSA member institutions, especially those which are present at this webinar, participating. And I think that you gave us a series of very important messages here, but especially regarding the standards and the conditions that are necessary for good actuarial work. You mentioned the ILO ISSA guidelines. Maybe I could also complement that the International Actuarial Association has the ISAP 2 guidelines, which are binding for actuarial work, and the national actuarial associations also have their codes of practice, their standards, which are very important, so that in the whole picture of this work, you build the trust. This is a word that you mentioned at some point, and also the very important message about the role of cooperation, of collaboration via the international institutions like ISSA, but also the peer-to-peer learning processes on how to improve and how to solve the challenges that you have in the practical work. So with this, I think we have a very nice transition to the practical part. So Andres and Fayad spoke about some, let's say, conceptual challenges of actuarial work. And we are very happy to have with us Harriman Mono from NEMA in Zambia. Harriman is one of our star, so to say, partners. And I would like to mention that Harriman and Zambia, NEMA, has been the first institution to engage with the ILO ISSA Actuarial Service Platform. So thank you very much for that trust back there some years ago. And I would also like to highlight that NEMA received a recognition in 2023 in the previous Forum for Africa of ISSA, which was held in Abidjan for actuarial work. So a distinction for its good practice in developing its actuarial capacity. So please, Harriman, can you please talk to us a little bit about how this actuarial analysis work supported the expansion of health coverage, which is the responsibility of NEMA. And what lessons do you draw from this experience, particularly in how to translate the technical work into policy decisions, which is one of the questions that Andres raised at the beginning, how to translate the messages and how to transform them into policies. Please, the floor is yours, Harriman.
Thank you so much, Helmut, for that kind introduction, and thank you for inviting me to present on the NEMA experience with regards to actuarial evaluation and translation from data and evidence into policy for the extension of coverage, especially to the poor and vulnerable populations under the National Health Insurance Scheme. So I'll put my slide on now, and I hope that is visible for everyone.
Yeah, well, we're going through the slides here. Here you are.
Great, thank you. So just briefly, the National Health Insurance Management Authority, NEMA, is the statutory body established by the National Health Insurance Act of 2018 to implement the National Health Insurance Scheme as a mandatory financing mechanism to achieve, among others, universal health coverage, as well as universal social protection. It is a contributory scheme, but it has exemptions for certain categories of the population that do not have a capacity to contribute. So the way it is really structured around the ILO guidelines on extension of coverage, as well as social security, on the principle of solidarity, where members contribute to the scheme based on their ability to pay, but they access services based on their need. So we rely purely on cross-subsidization through the principle of solidarity. Now, in such a case, there is a strong need for us to appreciate the sustainability and solvency of the scheme. But also importantly, given the economic situation of Zambia, where about 60% of the population is deemed poor and vulnerable, and yet they need access to healthcare services, then we need to have a good understanding of what it takes in terms of financial resources to extend health insurance coverage to the poor and vulnerable who have limited to no contributory capacity, to keep the scheme solvent, but also achieve the goal of universal health coverage and universal social protection. Based on that, when the scheme began, there was need to conduct intensive and really detailed actuarial evaluation to assess the liabilities that would need to be covered by the central government, by the state, to subsidize those that would otherwise not be able to contribute onto the scheme. But also, we needed to understand what the ideal contributory rate or the ideal contributory amount for those that have capacity to pay based on the distribution of incomes in the economy, or the ideal amount should be to the scheme to keep it solvent and viable and allow for cross-subsidization. So from our perspective, based on, of course, what my colleagues have presented in terms of the ILO, the guidelines on actuarial evaluation, we look at 4 key issues that we think drive the rationale for actuarial evaluation in the practice of the National Health Insurance Scheme. Of course, number 1 is the financial sustainability. We cannot achieve universal health coverage through a contributory scheme or universal social protection and cross-subsidization if the scheme is not financially solvent. Because we run an insurance fund where we have contributions and therefore expenditure, we analyze our financial sustainability based on the benefits equivalence principle. And this comes from the ISSA guidelines on actuarial evaluation, where at the minimum, the collections we get, whether through contributions or subsidies, should equal the liabilities that we pay. So we attain the collective equivalence. That is what we're always aspiring to. If there is any mismatch, especially negative mismatch, where you have collections less than contributions, so collections less than the liabilities, then of course you have to assess what is the required contribution to fill in that deficit. And that speaks to the support decision making. The board of the authority, which reports into the Minister of Health, Minister of Finance, and Minister of Labour and Social Security, need to engage government with clear data and evidence. And that is where the actuarial evaluation estimates come through, with robust estimates, with clear assumptions, with clear recommendations and options that the policymakers would potentially take on. And that, of course, also enhances transparency. We are a public scheme and are accountable to the public. We get collections from the public, and therefore we have to be accountable to them. The actuarial analysis and actuarial evaluation is for us an accountability document that we share with the public. And hence all our actuarial reports are public documents that people can appreciate what challenges we're facing, how we are actually utilizing those resources in terms of our benefits expenditure. But also, in times of crisis, actuarial evaluations allow us to adapt quickly to change. But even before the crisis, and as the previous speaker said, we don't have to wait for a crisis to happen. With frequent actuarial evaluations, we're able to predict what the future is likely to be. And with that prediction, we can take the corrective action required to prevent the crisis from occurring. So, in the case of Zambia, the key issue we needed to address, which led us to go to the ILO, at Helmut's department and unit, was the need for evidence to extend coverage to the non-contributing segment of the population, the poor and vulnerable, as well as extension of coverage to the informal economy. The Zambian government, in its National Health Strategic Plan, as well as its National Development Plan, aims to achieve universal health coverage, as well as universal social protection. It has a robust social assistance program, which supports poor and vulnerable households with a living subsidy every month. However, the poor and vulnerable households also need access to healthcare services, under the National Health Insurance Scheme. But because they're poor and vulnerable, they have no contributory capacity. So there is need to appreciate what the ideal subsidy would be to bring on board the people under the social assistance program onto the National Health Insurance Scheme, and therefore make possible the fusion of social assistance and social insurance, making possible integrated, robust social protection. So when we reached out to the ILO, we presented our case, and we agreed that we will run an actuarial evaluation, the first of its kind, that we will look at, first of all, what is the financial situation when we look at only those that are contributing, so the contributory aspect of things. Then we say, if we were now to extend coverage to the non-contributing segment of the population, and we know their profile because there is a really robust social assistance program, what would be the feasible liabilities that would accrue to the scheme? And with those feasible liabilities, how much in terms of deficits would accrue to the scheme based on the current contributions from the contributing segment of the population? Right? So if we're going to have cross-subsidization from the contributing segment to the non-contributing segment, we expect a liability. What is the size of that liability in terms of a deficit? And based on that, we assess, can this deficit be filled with changing the contributory rate or the contributory base, since we want here to ensure that there's solidarity in contribution? If not, what is the external source of income in terms of subsidies from the state that would be required to fill this deficit? And that is what we did. But as part of that process, we realized as a new scheme, actuarial analysis of this nature were rare, because we are the only national health insurance scheme in the country. So we needed to build capacity in-house to appreciate how to run these actuarial analysis, even outside the normal statutory analysis in terms of valuations. So the support from ILO was twofold: to estimate the feasible liabilities, as well as build in-house capacity of NEMA to be able to conduct actuarial analysis more frequently and also assess the solvency and sustainability of the scheme. And that is what we did. And one of the key things we produced, and this is the report that we produced, as you can see even the title, it talks about assessing the sustainability of the scheme as is, but also costing the extension of coverage the social cash transfer beneficiaries, which is the social assistance program. Through this program, we're able to access the ILO Health model, which Helmut just mentioned. We were the first country in the world to adopt that model and use it to run the actuarial analysis as well as build capacity in it. We were able to estimate the cost of extension to the non-contributing members of the population. And based on that, we developed what we call a policy position paper on feasible financing options for the extension of coverage. And the feasible financing options were twofold. The first financing option, of course, was to change the contributory rate and the contributory base for the segment of the population that has capacity to pay. And the other aspect was to look at what the deficit would be even when you have reformed the contributory rate and base, so that we get the support from the state or other cooperating partners to fill that deficit. And with that support, with that policy position paper, we engaged the Minister of Finance, we engaged the Minister of Health, we engaged the Minister of Labour and Social Security, and ultimately the Secretary to the Cabinet. And it was well received. And based on the way we distilled the paper, it was very clear on what we call the cost of inaction. If there is no action to be taken in the next 5 years, what will be the impact on the scheme, and what will be the impact on social, on social protection? What will be the impact in terms of progress towards universal health coverage? So with that position paper, we got the necessary buy-in, and we engaged through the ILO tripartite model, through the Tripartite Consultative Labour Council. We presented to the workers and the employers and the central government on what the ideal steps were to be taken so that the scheme remains solvent and we are able to achieve universal health coverage and universal social protection. Through the Ministry of Health, as well as through the Ministry of Labor, we're able to mobilize resources from cooperating partners. In this case, we got support from the Global Fund to pilot the extension of coverage to poor and vulnerable households that would otherwise not be on the scheme, and assess whether actually in the future the scheme could be the main pooling mechanism instead of having siloed funding as is currently the case. So that is an ongoing exercise actually that is going on. And with that support, we have been able to cover now over 200,000 individuals onto the scheme, poor and vulnerable individuals who would otherwise not have been on the scheme. And the trigger to that is the evidence that we generated, which made it possible to convince the cooperating partners, to convince the central government to provide that support. But as we conducted the analysis and built capacity, we realized that actually through actuarial analysis, we could come up with indicator dashboards that make it easy for reporting. So now we have created real-time indicator reporting dashboards that generate evidence on data daily, weekly, and monthly on the collections and expenditure. But also through that, we're now able to track levels, trends, and patterns of utilization, which helps in fraud, waste, and abuse detection and elimination, and therefore helps to reduce waste and keep the scheme solvent. So what have we done and what are we now doing based on that experience? We have established what we're calling a NEMA Actuarial Evaluation Committee. It's an in-house committee that interacts with the ILO ISSA health model, and we are able to generate simulations on our own to assess how the fund is looking like. Through that Actuarial Evaluation Committee, we've basically come up with a balance sheet, an actuarial evaluation balance sheet, that we feed information on what has happened in the previous month, and we're able to check what the position of the fund is in real time at every point. With that, we're also able now to conduct frequent actuarial evaluations. Annually, we're able to do that, but we're also able to do it every quarter. So from January to March, with the claims experience we have had, the contributions experience, and any changes in the economy with regards to more people being employed or changes in the wage structure, we simulate that and assess the impact, whether positive or negative, on the sustainability of the fund, and feedback to the board on what the policy measures should be in order to keep the scheme solvent. And again, like I said earlier, through the evaluation dashboards, we're able now to track fraud, waste, and abuse. And this has become a very powerful tool for what we call clinical audits. So before claims are paid, we run these dashboards and identify where the key outliers are. And then we truncate those key outliers, we put them aside and have the clinical team go in to assess whether those are real claims or they're fraudulent claims. And through this process, we have been able to actually claw back millions of US dollars in fraudulent claims, and we've been able to punish facilities that have been involved in fraud, keeping the scheme with high levels of integrity and solvent. Through this process as well, we're using it to provide insights and intelligence in benefit package reviews. We're able to assess what service, who is accessing the service, where, and what cost. And that is critical for benefit package reviews, as the health insurance benefit package is not a static package. It needs to be revised frequently to respond to the epidemiological profile as well as the economic profile of the country. And finally, through this process and the evidence we generate, we are able to confidently engage the Secretary of the Treasury, the Minister of Finance, and other stakeholders on national budget engagements, on the subsidies required for us to continue the extension of coverage to the poor and vulnerable, but as well as deficit financing in the overall scheme of things, should things not be moving according to our plan. And through this process, we also engage the National Assembly, the Parliament. The actual report that we produced with the support of the ILO is actually on the shelves of the National Assembly and is a key reference document when parliamentarians are debating reforms around the National Health Insurance Scheme. So briefly, that is what we're able to do as an implementing agency with actuarial analysis, and we continue to be grateful to the support of the ILO in building capacity further. Thank you.
Thank you so much, Harriman, for this very illustrative presentation. I think I am allowed to remind the audience that Zambia a few years ago was in a very difficult macroeconomic situation fiscally, debt, very high issues in negotiating an agreement with the IMF. And in this very difficult fiscal context with a very low fiscal space, NEMA did this big effort to strengthen its technical capacity to really underpin with tools, with dashboards, with actuarial models and a report that it is feasible to build a sustainable stepwise extension of the social health protection scheme in Zambia. Then Harriman went after the funds. He got the financing for this extension of coverage as he has demonstrated. And he created this, the NEMA, the institution as such, the team where Harriman is involved, created this understanding for the situation and the needs and the possible pathways that were open, which were possible for the policy on social health protection in Zambia. So very, very illustrative. Thank you very much for this presentation, Harriman. And I'm also very happy that we have a second participation from a partner of the ILO and from ISSA. ESIC is a huge institution in India. We will listen from Mr. Ashok Kumar Singh about the challenges that the institution faces and how actuarial work can be part of and has been part of the different steps, the plans. I would like to mention two or three things. Maybe initially that India has achieved a remarkable progress in terms of social protection development over the last years. If we look at the panel, at the World Social Protection Data Dashboard of the ILO, you see that the coverage indicator for India, the aggregate coverage indicator on social protection for India, grew from 19% in 2015 to 64% of the population with access to at least one social protection program in 2025. So one decade of big work which was done in several dimensions. Something like that doesn't happen from one day to the next, overnight. It is the result of many, many years of work on databases, on technical dimensions, and on development of human resources and on institutional developments. And the second remark, which I wanted to make here, is that India received last year in the World Social Security Forum the ISSA Award for Outstanding Achievements in Social Security, precisely because of this impressive development of the coverage of social protection in the country. So we are really very interested, Mr. Singh, to hear from you about the role of ESIC in the context of the Indian social protection system, the challenges that your institution is facing, and of course, with a focus on actuarial work that you are pursuing. Thank you very much for being part of this webinar. I think you have 15 minutes, and then we have 10 more minutes for questions and closing the webinar. Thank you very much. The floor is yours.
Thank you, Helmut. Thank you for a nice introduction, not only for me, but also for the country. Is it visible?
Yes, we see it.
Okay.
Yes.
Okay, thank you. So I will just take you through what the Employees State Insurance Corporation is all about. It's basically, it was established in 1948 through the Act of Parliament. And we started our activities in 1952. And recently we have now Code on Social Security, which was enacted in 2020, but it has been notified recently last year in November 2025. So as on today, we have a near about more than 145 million insured person and beneficiaries. We have more than 2.5 million registered employers, and we have more than 2,600 health facilities, hospital and dispensaries, which are owned by ESIC. Now the coverages, the ESIC benefits basically includes the medical benefit, sickness benefit, maternity benefit, disablement benefit, dependent benefit, and funeral benefit. So we basically, medical benefit includes OPD, IPD, and tertiary care. And sickness and maternity benefit is disablement benefit, and dependent benefit combined together is called as the cash benefits. Now this disablement benefit and dependent benefit, it's given in form of a pension, that if a worker dies or get incapacitated during the work or during the commutation from and to the work, then his family is entitled for 90% of the last wages, which is given to the family, which is inflation linked throughout the life of a spouse. This is the statutory basis for actuarial work. We have a regular actuarial valuation to assess the financial sustainability and contribution rates. Governance structures also ensures actuarial findings inform policy decisions at the highest level. We have a dedicated sanction post for actuarial professional within ESIC cadre. We all know that the quality of actuarials available within the country is not so good, and whatever is available, it's very difficult to source them. The governance principles are, we have a tripartite governance: employer, workers, government. So we all sit in a board, and our labor minister is the chairman. I am a director general who looks after day-to-day work. Financial autonomy, we are totally independent of the general budget. So it gives us a lot of room for innovation and also in implementing our schemes. Transparency through the regular reporting and parliamentary oversight. And we have a regular board meetings, and we also have a standing committee which is headed by our labor secretary. So we have a statutory valuations and reserve maintenance. So periodic long-term valuation of a long-term liabilities like pension, gratuity, leave, encashment, beneficiary pension. So pension gratuity mainly belongs to the staff who is working for the ESIC, but the beneficiary pension is and disabled pension is linked to the insured person. We also have a financial projections of all assets, liabilities, short-term and mid-term, up to 10 years of income and expenditure. We have a scenario-based policy for formulation. Recently, if the wages ceilings are enhanced, then what is the change in our income, eligibility revisions. And recently now our Code and Social Security has provision for covering the gig platform and unorganized workers. So we are working on a scheme for a gig platform and unorganized worker, and we need actuarial studies for that. So we have some standardized input from our regional offices, hospitals, dispensaries for an improved validation. We have a integration with the healthcare decision process. Actuarial output tracks disease incidents, accident causes, support targeted preventive medical camps, and optimize medical paramedical staffing from IPT and OPT. Challenges in building actuarial capacity, the shortage of actuaries, which I have already said. Though India is known for information technology, but in a field of actuary, we have to catch up. Second is developing in-house team. So in-house ESIC team is actively building, and we are looking out for both in-house and outsourcing model. We also have another challenge of complex and larger scale data. Managing the actuarial assessment of 145 million beneficiaries across the diverse risk pools and geography is a significant technical challenge. Keeping pace with the tools and technology, exploring to ILO ISSA Actuarial Evaluation Tool to modernize the method and align with the international good practices. The data challenges affecting the actuarial and policy analysis, inconsistencies and inadequate validation mechanism reduces the accuracy of actuarial projection. Dynamic workforce data, inclusion of gig and unorganized workers, rapidly growing segment of insurable population requires a newer technology intervention. And just to tell the audience that our unorganized sector is pretty large. We have a nearly 400 million workers, which comes under the unorganized definition. And we also know that just framing a scheme is not suffice. We also have to ensure that the scheme is equally affordable, and therefore working on these schemes is a big challenge. We have a data, but it's a fragmented. Like as of now, almost state government offers some schemes, central government offers some scheme, and ESIC looks after for the organized sector. So unorganized data is totally scattered. Health record integration data can help us is assessing the benefits utilization analysis and cost modeling. Legacy IT infrastructure is also affecting aging systems, real-time processing, and advanced analytics. We are working on a new system that is called Panchadip 2.0. It will take another maybe year or so before this can be reality. Then collectively, these gaps hinders the reliable projections and weakens the actuarial evidences base for the policy decision. Now, expanding actuarial valuation needs for the new worker segment. As I mentioned earlier, the new code and social security has expanded the coverage and brought in almost all the workers within the frame of the law. One is obviously gig and platform worker. We know that challenges in making scheme for them, no fixed employer, complex contribution modeling, variable income, intermittent work spells, risk pooling, new risk poolings, benchmark actuarial projections for India is 10 million gig workers. We have a plantation worker, isolated estate-based demography with unique health risk, high occupational hazard, pesticides, heat, dependent heavy household enhanced benefit modeling, valuation of maternity and sickness claim in the remote areas. And this plantation workers think as of today, it is the optional. It's not a compulsory where the plantation owners and workers decide to join the ESIC scheme, they can do so. For the gig and platform workers, we will be designing scheme which can be slightly different than what the scheme which we give it for the organized worker, for the reason that that the contribution all these segments are I mean gig and platform workers are contribution sensitive. Mines worker, again, it's a full ESIC scheme which will be applicable to them. And then comes the most challenging one, that is the unorganized workers. It's India's largest segment. Sparse data, high mobility, informal earnings, micro contribution models requires scholastic valuations, phased coverage expansions needs periodic revaluation. And as I mentioned that we have taken up this task challenge of universalizing our social sector or social security schemes at the time when our incomes have just started growing. Unlike the developed countries which decided to expand their social security coverage when their incomes were very high. So this is this gives us the another challenge for us to make it sustainable and ensure that actuarial valuations are done properly. So we are looking at ILO, ISSA actuarial evaluation tool can be very useful, very useful to us, and we have been continuously discussing with our team how we can leverage them. Internationally recognized actuarial framework we get ensures consistency, comparability, credibility of valuation across the schemes. Capacity building and training tools comes with the training support, enabling institutions to develop in-house actuarial expertise aligned with the ILO guidelines. Evidence-based actuarial projection strengthen the case for a sustainable financing and government policy making. So this is the ESSIC roadmap forward, strengthen in-house team. Phase 2, explore the possibility of adopting ILO and ISSA tools, build data infrastructure, evidence-based policy making. So as a phase 1, recruit and onboard qualified actuaries, data cleansing and validation. Phase 2, adopt ILO ISSA tools, align methodologies with international practice. Build data infrastructure, improve data quality, collection management system to support the robust actuarial analysis. And finally, evidence-based policy making. Policy decisions grounded in data analysis and empirical evidence to ensure sustainable social protection. So this is what I have to say from my side. Thank you, everyone, for a kind listening and attention. Thank you. Over to you, Helmut.
Yeah, many thanks, Ashok, for this really fascinating presentation about the size of your challenges. And on the other hand, we from the ILO and from ISSA are very happy to have you as our partner, and we will be very happy to work with you on all these challenges, which certainly will take a lot of effort and investment, have already taken and will continue taking a lot of effort and investment. So while people may still write questions in the Q&A box or raise their hands, let me just say for 1 minute, explain for 1 minute what is this actuarial service platform that was referred to by the two presentations, by the presentation of Herman with NEMA and by the presentation of Ashok from the Employees State Insurance Corporation. ILO and ISSA offer actuarial support services to the member institutions, but also to non-member institutions of ISSA in certain situations. With the tools ILO Pensions and ILO Health, which were mentioned here in this video conference. My colleague Ana Carolina is posting the link to the ILO ISSA Actuarial Services Platform in the chat. The institutions that are interested to learn more about each of the tools, they can get in contact with us and understand a little bit more what the tools do, how they are used, which are some preconditions. And then you will probably see Andres and me again, maybe Fayad, in video conferences with the respective institution. If you have a social health protection scheme, or if you have a pension system, you may subscribe to the Actuarial Service Platform. There is an annual fee, which is just for the cost sharing. It is the operational cost because the tool is in the cloud, so it is accessible from wherever you are in your country. It is important that you have an internet connection. And we from ILO can also help, and ISSA, we can also help connecting from Geneva and doing training, online training, which is cheaper to be done than in-person training. Of course, there can be also in-person training associated to the implementation of the tool. There is the offer of a training package, of course, also with a cost associated to a kind of a hands-on training, starting from scratch to talking about the extraction of the data from the databases, what kind of data is necessary to feed into the respective tool, then building the different assumptions, building the different projections, the population projection, the contributors projection, the beneficiaries projection, building the probability tables for different events, and then translating that into financial projections and reaching what we call this baseline scenario, which is the current situation and the perspectives for the next year, for the next years. If you want to have policy scenarios, reform scenarios, this is also possible to be done with the tool simulating different measures that are necessary and that are in line with the ILO standards, especially the Convention 102. I don't see. So if you are interested in knowing more, please get in contact with us. Perhaps Ana Carolina, you could write the email of Andres and mine in the chat. If and Fayad in the chat, any of us will be happy to receive your requests. I see that many of the questions in the Q&A box have already been answered. Thank you very much to the colleagues which have answered. And we still have 5 minutes to close the event. So if there is no hand raised, I would maybe pose a short question to Harriman, allowing him to kind of wrap up his excellent participation, and then a short question to Mr. Ashok Kumar Singh to also wrap up his participation. Harriman, I would like to ask you, I think that one point which is really fundamental from the experience of NEMA is how you could translate this actuarial result into policy decisions. Let me insist a little bit on that. And what would be your key recommendation after having that experience of a few years in developing actuarial capacity in-house and working on a first and then on a second actuarial evaluation, what would be your experience on how to better communicate with policymakers? Please, 1 minute,
Thank
and
you.
then, yeah.
Thank you, Helmut. I think the experience we have had so far is to actually bring the policymakers as part of the process from inception. Once we have the baseline information and on the basis of that baseline information, we work with the key stakeholders, the key policymakers at the technical level for them to appreciate what the ultimate results would be. So just a small example, for this actual evaluation, we're now working with people from the Ministry of Health, as well as people from the Ministry of Finance and the Ministry of Labor, because ultimately these will be the policymakers that will decide on the implementation of the recommendations. So if you get the technical staff in the key policy ministries, the key policy makers as part of the process, then you have initial buy-in and ownership of the results, and you translate them into policy recommendations thereafter. Thank you.
Yes, thank you very much. Mr. Ashok Kumar Singh, I really am very thankful for your presentation and also for showing us the dimension of the challenges. And of course, ESSIC is the Employee State Insurance Corporation is one of the big leading institutions covering especially the contributory dimension of social protection in India. And I suppose that you also have a strong relationship, lateral relationship with other institutions. So the coordination within the different institutions and programs. Do you have any recommendation on how to kind of build a synergy that can benefit, that can improve the coordination of and give us advantages in terms of implementing actuarial work as well and technical work in general to improve the capacities of our institutions?
Yeah, Helmut, to be honest with you, till we were doing only for the organized workers, we were we were having data, though it was scattered and may not be clean data, but we had a data and we were doing our actuarial work. But now the real challenge starts when we are supposed to do the valuation work for the unorganized sector workers. And there the data points are scattered. We are planning to have regular meetings with the other departments of Government of India. Also, we want to have a data of the state governments. So it's a federal system, federal structure which is coming in play. But luckily, we have got our institutions also federal, like our policy also federal, like the gig and platform worker and social security schemes. There are some schemes which are supposed to be implemented by union government, and some schemes are supposed to be implemented by state government. So in our kind of a challenge, it's basically the federal system which makes our coordination work easy. But where this data is kept, that is the most challenging, because the data will be kept in a different silos, and getting the data on a standardized platform is going to be a challenge. But we are going to use our mechanisms of state and federal government to move ahead.
Thank you very much. I see that there are still two questions in the Q&A which have not been answered. So one of them refers to Nigeria. How can this program or project be extended to the informal workers, especially the waste pickers in Nigeria? I guess it is something related to the experience of Zambia, the national health insurance system of Zambia. I think that, Harriman, if you allow me to quickly answer that question, you showed in your presentation that the projection of the financing needs, and then the strong empirical grounds on which you show to both the government and to international partners the financing needs for extending the basic health protection to beneficiaries of the cash transfer program, were an essential tool, were an essential step for making this extension to 200,000 beneficiaries of the cash transfer program a reality. I think this is one of the big points of your presentation. And then, the other question was, there was a question also related to the impact of the coverage extension on the solvency on the NHIS. Harriman, you just answered to it. Thank you very much. And exactly, the actuarial work has allowed to clarify that which conditions are necessary for not impacting the solvency of the scheme in the long run. Well, I will conclude. We are now 1 minute over time, and I will conclude here with a few key takeaways. I took note here that I think that a key message is actuarial work is a core governance function, not just a technical exercise. Our participants also made it very clear that it requires a lot of work in improving data communication institutional capacity. Translating the analysis into policy decisions is a key challenge. And something which also came out very clearly to me is that strengthening actuarial capacity is a continuous learning and investment process across institutions and systems. So with this, I would like to warmly thank to our speakers, our excellent contributions. I would warmly would like to thank to ISSA for the strong partnership and collaboration. I would like to thank to socialprotection.org, Fernanda and all the team at IPEA, at UNRIST for their work which did this webinar possible. Just to remind you, please to complete the short survey after the session and to join us for the final webinar of the series on the 26th of May. So thank you very much to all of you. I wish you all an excellent day. Thank you.